evening, everyone. Always exciting to speak on this forum. My name is Manjula Rao, and I'm a consultant breast surgeon at Adyar Cancer Institute. I'd like to welcome you all to this evening's panel discussion on workplace harassment and bullying. I'm sure that a vast majority of us are no strangers to harassment in the workplace, and it's quite prevalent as proved by statistics, and unnervingly so. It's also on the rise. Now, this is an unsavory entity, much like dirt, which is often brushed under the carpet, hidden away from prying eyes. Yet, letting it build unobtrusively only worsens the situation. We have let this unsavory wound fester long enough. It is time to whip out those scalpels and forceps, take a closer look at the wound and at this rot, and hopefully take a step closer to healing this wound. So before I move ahead and introduce the panelists, I would like to let you all know that at the end of this panel discussion, we will be throwing the forum open to the audience, wherein you may feel free to share your experiences and any stories that you may have. Moving on to introduce my lovely panelists for the day, in alphabetical order, Dr. Jayapriya MS, Consultant General Surgeon from Chennai with special interest in laparoscopy and GI surgery. Dr. Jayashree Todkar, ma'am, are you with us? I'm not sure Dr. Jayashree has joined as yet. Madam is a general laparoscopic and bariatric surgeon, founder of the Indian Institute for Metabolic Sciences and JT Foundations, and convener of the Maharashtra State Obesity and Diabetes Task Force, only a few of her vast list of accomplishments. Dr. Rajesh Ballal, a former HOD and professor of general surgery, K.S. Hegde Medical Academy, Mangalore. He was the invited faculty for the teaching program at the state chapter of ASI, guest faculty at SRMC Annual Rapid Review course in 2018. Dr. Sangeetha Shankar Narayanan is a consultant psychiatrist at SIMS Hospital in Chennai. She completed her psychiatric training in UK after studying MD medicine in India, and she's completed her MBA at the Lancaster University in UK. And last but not the least, Dr. Santosh John Abraham, sir requires no introduction, and yet, as is customary, sir is a senior consultant surgeon and HOD of surgery at Lourdes Hospital, Cochin, editor and publisher of 4 volumes of the book titled Contemporary Surgery, and has contributed to chapters in other books as well. He was elected as the national president of ASI in 2015 and director of the Academic Council ASI 2017 to 21. I welcome you all. I am very pleased to have you all today, this evening, for this discussion. So moving on, to begin with, I would like to ask you all, what constitutes harassment or bullying in the workplace? Can we start with Dr. Santosh, sir? Could you give us your inputs as to what you think is constitutes harassment in the workplace?
Okay.
Dr. Santosh, sir? I think sir may be having some network issues until we get him back online. Dr. Rajesh Ballal, sir?
Yes, first of all, I'm very grateful to Dr. Manjula and this forum, the LGS, for getting me on this panel. I'm sure as we go on, we'll find out more about this rather difficult problem, like Dr. Manjula said, but I think you forgot to mention one before I define this. You said you'll throw open the this one to the
yes.
People in the audience.
Yes.
Please tell them that you will not shame somebody personally. Yes. The idea of this probably is to, for all of us, is to improve. So while you can be specific to a certain extent, kindly don't name anybody. It may be one of us, right? So with that as a background, if you ask me what this harassment or bullying probably is, if you want me to condense it and say, I'd probably say it is behavior which is inappropriate for a particular time, place, and person. to put it simply.
It could be any kind of behavior.
Yes. Inappropriate for that particular time, for that particular person, at that particular place, to put it very broadly.
Right. Dr. Jayapriya, could you add to that? Do you have something to add to that?
Okay, so if you ask me broadly, when somebody says somebody is harassed at workplace, what comes to my mind is somebody yelling at somebody, threatening somebody, verbally abusing someone in front of other colleagues or personally.
Hello.
And the
Yes, ma'am.
common
Dr. Jayashree, just a minute, ma'am. Yes, Dr. JP, please continue.
Yeah, so the other thing that comes to my mind, what I've seen in my career is aggression. So not necessarily a verbal abuse. Somebody, somebody's body language is not okay. They're trying to threaten you by the way they behave, and making the work environment hostile to someone by various kinds of behavior.
Right. We have Dr. Jayashree Todkar has joined us. Good evening, ma'am.
Hi. Good evening.
Good evening, ma'am. Welcome to this forum. We have Dr. Rajesh Ballal with us, Dr. Santosh John Abraham. I believe sir's internet connection may be
Santosh is back. Manjula is there.
I'm back.
Oh, lovely. Welcome, sir. Hello.
Yep.
So Dr. Santosh John Abraham and ma'am Dr. Jayashree Todkar, I was just asking everyone what according to them constitutes harassment or bullying in the workplace. So Dr. Santosh, could you tell us what you think could amount to harassment in the workplace? Dr. Santosh, sir? I think sir's facing network issues, sir's in his hometown. So Dr. Jayashree Todkar, ma'am, could you tell us what according to you constitutes harassment or bullying in the workplace?
Actually, it is not very highly defined what should be called as harassment. But within your colleague groups, you are able to understand what is going on in the normal pathway and what is harassment. What we experience sometimes ourselves or sometimes through the colleagues or through the students who tell us their experiences. One is there can be a very abnormal behavior from the colleague in terms of taunting, depending upon maybe it is gender oriented taunting or it can be just like that. Number two, it can be becoming very hostile whenever any request is put on. Number three, it can be a lot of timing wise or job wise abnormal demands put to you. For example, as a maybe sometimes girls tell us that they are told by their colleagues that you must serve the food to us and this is something which you must do, or maybe odd hours you should be present even though there is no specific indication for any particular job that time. So harassment need not be defined and may not be given in a prototype manner, but it can be sensed by a woman whenever there is harassment. It can be physical, it can be emotional, it can be psychological, something that tortures you, which is not in the protocol manner, should be called as harassment.
Right. Thank you, ma'am. Dr. Rajesh Ballal, sir.
Yes.
I know you're itching to say something.
Yeah. Am I allowed to pick holes?
Yes, sir.
I am. Okay, right. I see a slide here which says repetitive negative behavior.
Yes.
Means we have already accepted and put it under the carpet that unless it is repetitive, it's not harassment. One, which I am disagreeing.
Right.
The second I'm finding fault is this is the, we've concentrated so much on this bullying behavior of the typical, the androgen androgen filled, whatever, the macho character. You know, I've been in this profession long enough. I'm more worried about the slimy, the backstabbing type. That sort of harassment is what I'm more worried about. You know, you're on guard against these typical bullies, but the harassment is much more subtle. You know, it's when you get treated like a, you know, I call it like treating you like a piece of furniture. That hurts more. That harassment is, you must be much more aware of.
Yes, when one is taken for granted.
True.
And not given emphasis to. So this definition that I have put up is just one such, which has been given by the Workplace Bullying College in the United States of America. And like Sir said, it does say that it includes repetitive negative behavior. So a single isolated incident, then is that not harassment? Is that not bullying? So Dr. Sangeetha, I would like to bring you in here, and I want to ask you, if there is an isolated, unsavory incident, uh, which amounts to harassment that occurs, uh, can that just be let off? Can we just let it go as being insignificant? And I also would like you to tell us, is there a difference between harassment and bullying, or are they one and the same?
Okay, so I suppose one thing which all of us are agreeing is how complex it is to define what is bullying. Because you know, as you put in on the definition, is it repetitive? Then is it something which happens systematically? How do we define who's a victim? How do we define who's a perpetrator? But one thing which I think across whatever evidence or whatever articles one comes across, one thing which most people agree on is there should be an imbalance of power, which means that the victim is in a position where they are not able to defend themselves. I think that's the one crux of the very important bit of bullying, which is agreed, which has at least some consensus. Rest of the things is all, you know, still there's a lot of debate. How do you define this very, very complex, but nevertheless a very common event which happens in probably every workplace? Now, coming back to your specific question that does it have to be repetitive? Can it be one-off? So again, this is where the problem is. How do we agree? I would say it depends again on very much on the situation. So if you have the person who's bullied, the perpetrator is standing on a podium and humiliating somebody, either a person or group of person, in a public forum, where the victims of the bullying are not in a position to retaliate, they are not able to defend themselves. So it might be a one-off event, but the intensity of the event, where it's happening in a big, you know, it's happening in amongst a lot of people, that in itself can be construed as bullying or can be construed as harassment. So which takes us to the very important thing, is that it is a very, very subjective thing. You know, what might be considered bullying by one individual might be considered as, oh, this is a chalta hai behavior, this is something, you know, we don't need to, why are we making a big fuss out of it? So going back, yes, one can be, depending upon the situation, but often the definition is it has to be systematic, it has to be repetitive, and the victim doesn't have the ability to defend themselves. Now the second question you asked me was, how is there a difference between harassment and bullying?
And bullying.
There is a lot of, you know, kind of the words get used interchangeably, and there's a third word called mobbing as well. So harassment, bullying, mobbing, these are different terms which get used quite interchangeably. And in my mind, I would think that bullying is the next step of harassment. So maybe it's more intense, it's more repetitive, it is more kind of goal directed, but it is in the literature, it often gets used interchangeably.
Right. So what we have, so what the consensus is that bullying bullying is not necessarily, you know, it cannot be attributed to one particular action or one particular behavior, right? So it can be verbal, it can be intimidatory in nature, it can be related to the work performance of the individual, it can be institutional, where the workplace encourages it, right? Wherein maybe the boss or the immediate senior or somebody just gives uh, way more work that can be completed in a given amount of time and expect them to complete it, and then they are wrongfully punished or refused promotions for the same, and they are singled out in doing this, right?
I
Do we have?
think what you
Yes, yes, ma'am.
um, is that
Hello.
question directed to me? To
Yes,
Yeah.
yes.
I think what you say is right, and I think one of the other things which you would like to include in this types of bullying is cyberbullying. Again, something which is very common with WhatsApp and social media, where a lot of things happen via social media. So yes, I think it includes everything and anything which a person perceives to be inappropriate to their culture, to their upbringing, and they're not able to kind of defend themselves. I think that is where the consensus is, in my opinion.
Right, right. Do we have Dr. Santosh with us, sir? Right. So,
Dr. Santosh is around, but he's just messaged me that the signals are weak.
yes, yes, yes.
I'll just check whether
Sir
it's
has mentioned that. Sir has mentioned that. Right, right. So, Dr. Rajesh Balal, sir, in so many years of your practice, and while you've been teaching in medical colleges, how prevalent do you think is bullying is? Has it always been around, or is it something that is coming to the fore only now? Have you witnessed it happening in the past?
You asking me as a student or as a teacher?
Both,
Because
both
I think that
student, teacher.
people are talking of perpetrators, etc. So sometimes I wonder which category am I in? Am I the perpetrator or the victim? But
Why don't you show us both situations, sir, as
right,
the victim and maybe even the
right, okay.
perpetrator?
Is it there? Definitely, it's there. There is no doubt. Otherwise, we wouldn't be having this discussion at all. It is there in varying degrees. It hurts more sometimes, but every time it will hurt. As a student, probably it is perceived. I don't know how my students perceive me, whether it is, madam called it bullying and mobbing, etc., etc. I'm not sure we've reached there. I personally have reached there. I hope not. But in spite of the best intentions, I still think that maybe there are students who will perceive me as a perpetrator because perceptions vary. Have I been a victim? Probably yes. The most famous one I have to quote is as a junior consultant, I came back trained in laparoscopy. And fortunately or unfortunately, my teacher was not trained. And he was in control of this laparoscopic set. I'm talking of this one-off incident. Right. And in 15 days, I joined as a junior staff. My teacher put up a board outside the theater. He said endoscopy and laparoscopy not to be touched by junior consultants and postgraduates. And that time we used to joke, because I had colleagues and we used to joke. I said, in the British Raj, there was a board which says Indians and dogs not allowed inside. So it was there. I think it's still there. Probably people are more aware of it now.
And it is being talked of now.
Yes. Yes.
For a very long time, I think the behavior was normalized. It was considered expected in the field, and maybe even one was said to one was expected to go through the rigors of which included bullying in order to become a successful person, a successful surgeon.
True.
Dr. Jayashree Todkar, ma'am, do you think, have you witnessed bullying or harassment? Have you undergone it personally or witnessed someone, juniors, colleagues undergoing it?
Yes, I do have some first-hand experiences also, and I do have the experience from the others which I have heard from them and witnessed at times. In my mind, I think this is something which is a class difference, which makes it makes you, even though you don't know him here, is not to know that person, find out the problems or find out the deficiencies and attack on them. It is something which is a negative mind which starts working on it. This is one part I've seen. Class difference, when I say, it is like the seniors to the juniors. It is like the men to the women at times. But of course, we have seen that even in the gynec department, which is full of women's, still it is happening that they have got harassments and bullying for each other. So there is not a single, or maybe at times I have seen the caste and the religion differences also, which you as a human being are really ashamed of being a witness of those stories also. So we can understand the way people who are the takers of that, how bad they must be feeling, how humiliated they must be feeling. One of the things I want to tell you, this is something which is a very weird thing. The most weird thing which I have heard till date is, I'm not going to put the name of the woman surgeon who has experienced this herself, but there were times where when people in her unit, the guys in her unit, senior guys in her unit, she was going to be a surgeon. She was the most junior person in the unit that time. She was told to do some shaving of some patients, wherein she used to do, because as we all know, when we become surgeons, the teaching is, now you are a boxer. You are not a woman or a man or a son of somebody or a daughter of somebody. You are a boxer, you are in the ring and you have to do your good jobs. So she used to do all those things which we all used to do. And some of the times it happened that she was harassed because of not doing it properly, wherein she, being the most junior, was little hesitant doing the thing. So one of her seniors in front of us, he scolded her so badly in the passage of the corridor of the theater, and he said, if you don't do it properly next time, I will do it on you and you will be remembering it for the lifetime. I think this was the worst one,
That is
the
wild.
verbal one I have heard in my life till date. And till date, I don't talk to that person, even though he has become a gentleman surgeon now. Those things cannot go out of my mind and anybody who witnessed it. These are few things. This was the worst one which I have seen. But also I have seen at times, whenever a woman or a girl surgeon is working with you as a colleague, it is okay. Whenever she is working with you as a subordinate, it is okay. Whenever she asks for help to you, that is a very satisfying ego type of conditions, that is also okay. But when she becomes superior, when she becomes going into the shoes of your boss or somebody who is now going to hold the office, she suddenly starts becoming like a villain and all bad things start going around and around. This is just jealousy. I have myself experienced this. I have heard for many other girls also where they are experiencing jealousy, smear campaigning, and what people find is a woman's character is probably the most delicate thing where they want to, you know, hit it, or maybe they want to make it a weapon for hurting a woman.
I
Obviously,
thank you.
I'm sorry. Shall I
Tell me, ma'am.
continue?
Yes, ma'am, please tell us.
Obviously, we are brought up in a society where these things start eating our mind and these things start killing us. Few of the times when I experienced this for myself and for some of the friends, I just spoke this to my teacher. Fortunately, she was Dr. Mrs. Mehta, one of the lionesses in this field. And I'm so happy that I got somebody like her as my teacher. I told her these things, madam, how this can happen? How do we tackle this? She told me one thing: whenever you are facing a guy, you behave like a guy. Whenever you are dealing with a girl, you behave like a girl. Typically, this will take out your body language, which makes you timid. And typically, you start behaving like just one of the human beings who
Right.
doesn't have those caste, creeds, or any kind of, religion
Yes.
or gender or anything. I
Yes.
think this message should be going to everybody across, that
Yes.
we start behaving as confident as a human being and treat anybody in front of you as a human being only. Then
Yes.
typically things will remain with respect and dignity for both the parties.
Yes, ma'am. I thank you so much for sharing that story. You have actually shared something, wherein harassment or bullying can result as a result of gender bias predominantly. So this kind of brings memories flooding back, because I recall one of a senior PG who would take immense pleasure in punishing the juniors by ensuring that his patients would get constipated and making the juniors do manual evacuation of stools every time as a means of punishing them. Uh, it may seem funny, and when I say it, I always I smile, I break into a smile, I laugh, but it wasn't amusing then. Another thing that I'm noticing, I thought that when we would discuss workplace harassment, bullying, I thought people would talk about physical harassment. I thought people would talk about being yelled at and being criticized every day, little by little, slowly, that they just their confidence gets worn away. But apart from that, I'm so glad that very early on in this discussion, we're not talking about the very obvious ways in which harassment occurs. We're talking about the most subtle signs, the most subtle incidents that happen, which is this kind of behavior is often normalized. It's considered maybe sometimes even funny and part and parcel of surgical training, but it is disturbing uh, nevertheless. And it has a very long lasting it makes a very long lasting dent in the psyche of the individual involved. Before I move on, I'm actually going to narrate a story, and before I move on, I want to ask the panelists, do you have anything else to add with regard to whatever has been discussed? Dr. Rajesh Balal, sir?
Yes, there's so much being said against the man.
Yes.
Does the reverse happen? I want to ask the ladies, I want to ask my distinguished panelists, because Dr. Santosh is not there. Most of us are made to look like lechers, which we may be or may not. That's a different one. But, it's often said that women are harassed more often by colleagues who are women, probably equally or more than the men who are harassing them. Do you have anything to say about that?
May I interject
Please.
before Dr. Jayashree Todkar? So I actually do have something to say about that. People who know me, those who've spoken to me, and very recently, I have actually been caught when I often when I talk about women bosses, I am often known to say, "Oh no, his boss is a woman. I feel sad for him," or "Oh, my boss is a woman. I don't know what I'm going to do." That itself is evidence enough of the fact that I don't think harassment
Dr.
only.
Manjula, can I interject here?
Yes, sir.
Rajesh Balal's question has not been answered. This
Yes,
is
sir.
sidestepping. I'm sorry, I'm not a part of the panel, but I just jumped in just because he's all alone there to say that I have seen women surgeons, senior women surgeons, senior women radiologists, senior women other specialties, gynecologists harassing women surgical colleagues.
True.
Harassing no
That's
end.
true. That's true. So what? And I actually agree with that, sir. And that's what I'm trying to say. That I don't know if I should say this on this forum, but uh, where I am scared of having a woman boss, because I know them to be at least, I don't know if I'm being politically correct and if I should even be saying this, but that's one of the main reasons why I did not enter obstetrics and gynecology, because I felt that women bosses are harder on the women, and maybe even unfairly so. And at this point, even though I don't have any evidence, but I do know of people who've also told me, like men who've had women bosses, and they have also been treated unfairly. So while as a woman, I think it's fantastic that, you know, we're discussing, you know, harassment that occurs as a result of gender bias. I would like to be fair and also recognize the other side. Women bosses can also be hard on their juniors, and also when and also on men concerned, if the men are their juniors or their colleagues. I think both sides ought to be recognized. uh, Sir, Dr. Patta, sir, do you have something to share with regard to that?
Can I say something?
Yes.
Again,
Yes,
this
JP.
entire discussion, the denominator here is the matrix of power. Somebody who's powerful, okay, higher up in the hierarchy, is harassing somebody who is junior. So man or woman, this is what the common denominator that Dr. Sangeetha mentioned as well. And if I may digress, one common harassment that I notice in the medical fraternity is during ward rounds. Okay, they call it a teaching academic round. So there is a bunch of people there. The senior most questions the junior most. Okay, and our ward rounds is supposed to be in proper English, grammatical English. Indians, this is not our native language. So, and it all, the kind of English depends on how you're brought up, what school you went, and situations like that. And many times the junior most is cornered on for one word that he or she said, and harassed. To be honest, harassed. And how can that be called an academic round? This happens in every medical college, in every postgraduate institution. So many times it's a bunch and there's no academics. I'm not saying every time it happens, but by and large this happens. And this junior most person is scared. He might have less self-confidence. He might have some doubts, or he might not know how to express it. And then his self-esteem is further dented after the round. So it's no way helping the junior person to grow and become a better person. So I somehow feel we should do away with this ward rounds question answer session, and it should be I mean, of course there are great teachers who bring these weaklings up. They identify who's not very confident and encourage them to speak and come. But by and large, the weaklings are made weaker, and the bright sharp ones who can answer very well, their ego is boosted. And I consider this harassment and bullying.
So I agree with Dr. Jayapriya's observation, though I do not agree with what rounds be and the question and answer session being done with. What I feel needs a modification is the behavior of the said teacher or the said consultant, because I have been very lucky to have teachers, and one of them, Dr. Rajesh Balal, is also on the panel, and I would like to mention this. This was something that I was going to ask further ahead in our discussion, that I often notice, much to my disappointment, that Dr. Rajesh Balal would, amongst other teachers, he would not ask only the front benchers for the answers, those who are always eager with their hands up and they always have an answer at the tip of the tongue. He would pick out the quiet ones, hiding at the back, the shy ones, those unsure of answers, make them come forward and coax an answer out of them, even if it is wrong, even if it means, and give them time, even if it means making them think then and there. So I think it's a behavioral modification amongst the seniors that might be more helpful. Yes, I don't think the question and answer round should be done away with.
Now, I'm kind of saying this type of question and answer round.
Right.
For example,
right.
And there are other situations where people are trying to know, the boss is trying to know what the junior knows and doesn't know, and trying to build up on their knowledge. But more often than not, it is, shaming them and say, you don't even know this. So
Yes.
that has to be done away with.
Yes, shaming them and then walking away without giving them an answer and telling them, read and come, or read and tell me, or maybe even sometimes ending it with a curse or a cuss word. Right, sir. So I told you all that I was going to narrate a story, right? So there's this institute, there's this final year postgraduate, right? He's not the brightest of sparks academically. And often, when asked to speak, he stutters and, he speaks haltingly. But on the other end, he's a very resourceful person. You need anything, you should go to him. He has a lot of connections. And very eager to grab all sorts of opportunities to learn, even if it means creating his own, always on the good side of teachers. He knew exactly which side of the bread to butter, right? So this fellow is a final year PG. Now enter the scene, the new batch of first year postgraduates, general surgery. And amongst this whole group, there is this one boy, a very popular face, a well-known face, a very well-liked face. He gets along famously with his peers and the nursing staff. Whichever ward he's in charge of, you always never fails to get a laugh out of his patients or the staff, right? Very kind, considerate fellow. For some reason, now this senior takes a dislike to this gentleman, right? And he proceeds initially to make life difficult for him, very difficult. So initially, it starts in bits and starts and unobtrusively, nobody realizes. But then it slowly builds over a period of time. There's a pattern, days into weeks, weeks into months, until this junior can take it no more. His personality undergoes a complete change and he decides to leave the course, right? So I would like to ask you, Dr. Jayashree, what do you think, Dr. Jayashree, ma'am? Right.
Am I audible?
Yes, ma'am, you are. So did you hear did you hear the story, the instance that I narrated?
No, I could just hear that he is asked some questions, but then I could not understand the whole, I could not hear it whole.
Okay, ma'am, I will just come back to you. Before that, I would like to ask Dr. Jayapriya, why do you think was this particular, of that batch of juniors, why do you think was this boy selected as chosen as the victim? And why was he bullied of this whole group? Why was it only him? Is there a particular personality that you attribute? Is there a victim complex?
Okay, it's difficult to answer this, but then again, the denominator is junior most, he's new to the department. And what I can see, the pattern is when somebody new comes and you say he's bright, he's sharp, patients are smiling and he's answering, he's trying to learn. So he seems to be a nice kid, somebody who has a bright spark and has a future. So this senior person finds him as a threat. And so this is a target. The other reason possibly is, he's very naive. Maybe he's looking vulnerable and the types that won't retaliate, maybe his body language says so that, he's afraid of speaking up for himself and things like that. So maybe that could be a reason.
That could be a reason. Dr. Rajesh Balal, sir, do you think?
No, just a minute. One of our
Yes.
colleagues is very quiet. You're deliberately not asking her questions.
Dr. Sangeetha, no.
Yes.
Dr. Sangeetha, I am coming back to her because she's the expert.
Okay.
She's the expert, so she's going to round up everything and
I'm worried whether she will analyze all of us, and form patterns for each of the panelists. You see, that's what I'm more worried about.
No, sir, no need to worry. I won't be doing anything like that.
Yes.
So, Dr. Rajesh Balal, sir, I want to ask you, what makes a bully? Do you think it's an inborn personality or do you think he's a victim of circumstance?
Probably a combination of both. If you're not the macho type, usually you don't end up being a bully, whatever the circumstances are. But I agree that, there must be the seed and the soil, that sort of a thing. You must have the circumstances which allow you to become a bully. You might be very big, etc. But if there are sufficient checks and balances, there's no way you can become. So, it's almost like the first time that something like this starts, if you find that there is a check and a balance and that person is told that you cannot continue like this, probably it may not. At least overtly, it will not.
Overtly, it may not.
It will not.
Right.
So, inborn personality combined with circumstances. Victim,
Right.
almost always, it's been repetitively said here, it's the balance of power ultimately. As a
Right.
postgraduate, I've joked, I said, if the head of the department requests you, can you please fill petrol to my car? Will you say yes or no? I will say yes as a
I
postgraduate
will
because I
definitely
passed
say
my
yes.
exam.
And we
Right.
have
So
witnessed
I'm victim, yes, but he is requesting me.
We have
Right. So,
witnessed it. I've heard of stories where they're asked to fill petrol, post their letters,
yes.
whatnot, buy groceries.
Yes. Buy saris for the wife, so many
Yes,
things.
yes, indeed,
So,
indeed.
yes.
I coming to Dr. Sangeetha, right? So what I want you to, I wanted to request you if you could tell us, give us your professional opinion. Do you think there is something that's known as a bullying complex, or and also on the other hand, a victim complex, or do you think it's interchangeable? And again, like Sir said, circumstantial.
See, I think one thing which a lot of data shows or proves is that most of the time a person who's a bully would have been bullied at some point in their life. I think there is a lot of consensus in that. Nobody is born bully. Some may be, some because of their personality, because of the inherent nature, where they have certain personalities where they get a lot of pleasure in inflicting pain. But most of the time, it is the bully is a victim of a bully at some point in their life, maybe as a childhood or in their in the college days, or as they kind of continue in the ladder, they would have been a victim themselves. And what it becomes is, for example, I would give an example is often bullying in a workplace leads to hostile work environment. And why it leads to hostile work environment is a person bullies one person during a social interaction, and you find that in a different social interaction the victim retaliates to the bully. So this kind of is a constant it's the interaction just keeps going on. And we talk about power imbalance, and often we are talking about the medical college scenario. But then once you leave medical college, bullying still happens. It happens in
Still
corporates, it
happens.
happens in the private sector. And there, the power is not a it's not so well defined. So, for example, a head of a department might have a power like which of the junior comes and assist him, but still the same senior has to depend on his juniors, because these juniors have to do the work for him. These are the juniors who kind of interact with the patients. So if the power balance there isn't as straightforward, so what we often the data shows is it is power and dependency. There are two things which need to be taken into consideration. So the bully might be dependent on the victim, and the victim might sometimes become a bully in a totally different social interaction. So but then if you want to stereotype a bully, often you would come across that these are individuals who come from a very dysfunctional family. They would have a chaotic lifestyle. There would be issues happening in the school. They could be having psychiatric issues as a child. And then they grow up, you find that the problem just multiplies, where they have kind of, again, a lot of substance misuse. Maybe they might be having anxiety, depression. But most importantly, most of the bully have very, very low self-esteem. So often when we talk about bullies, we talk about people being this macho person who's well liked,
Right.
who's charismatic, and who puts down people. I don't think that's always the case. Most of the time these bullies have a very, very low self-esteem, and the pain that they inflict on the victim is actually the pain they themselves feel most
Feel.
of the time, and that infliction actually is a depiction of what they feel in themselves. So often it's not a very a straightforward thing as some of the other people were kind of talking about. The other thing which I would want to just kind of digressing from the question is speak on what Dr. Jayashree was talking about is the bystander effect. So what
Hmm.
happens is, for example, she was talking about that once she stopped talking to this male surgeon
Right.
since she heard about it, she witnessed it. So what happens? We talk only about the bully and the victim. We also need to talk about the bystander. So people who are kind of witnessing this whole episode happening, how does it make them feel? It also makes them feel quite kind of helpless, vulnerable. It might make them feel angry, and then there has a knock-on effect. Kind of their interactions, their behaviors with the bully and the victim also changes. So the ripple effect of bullying, especially if it is something which is happening continuously in a workplace, can be felt, can be far reaching.
Right. True. True. And when you spoke about ripple effect, it just brought to mind this discussion that I had with a few colleagues, wherein where we saw this particular senior verbally abuse someone, and after that, every time we would approach the said senior, automatically you know we would have this anxiety creep in, or tachycardia. It's sort of anticipating verbal abuse towards us, even though there was no indication of that happening, but just that we've witnessed it happening with someone else. I
And I
Yes, yes, Dr. Sangeetha.
Yeah, so I think that is what we call as the the bystander effect. You see it even in a road traffic accident where there'll be a couple of people who will help the victim, but then there will be a whole mob standing outside who carry with them a lot of these negative emotions and kind of the lot of the kind of emotional turmoil, and probably that is what you are probably alluding to here.
True, true. That was exactly what I was referring to. So there is data which sort of points out to the fact that majority of the bullying or harassment is from people on, people in the higher rungs of hierarchy. Can it occur the other way around? Can people in the higher rungs of hierarchy also be victims? Dr. Jayashree, I think you wanted to speak about that. You had a viewpoint on that.
Yes, what I have learned from many others also is at times there are some aggressive personalities in your subordinates which can make your life difficult. I think it is their personality problem, wherein even the normal orders or something which is a very obviously in the best interest of the work, those orders also they are not able to follow, and they may not be able to they start cribbing about each and
I'm sorry. I think you're having network issues.
so I think for this it is not about a troublesome personality.
Okay. I'm sorry, ma'am. I lost most of that. Hello. Right. Uh, so until we get Dr. Jayashree Todkar back online, uh, I'd like to ask the panel.
Can you hear me now? Hello.
Yes, yes, definitely.
Yes.
Yes, much better, much better.
Yeah, so this is, I think this is a personality problem at times, that whatever your seniors are going to tell you in the best interest of yourself and for the performance abilities to improve, at times people take it in a very negative way, but uh, these examples are pretty much less as compared to the other way around.
Right. So
And
that actually brings us that.
sometimes
Yes, ma'am.
and sometimes when we have seen this in my unit, particularly when I've seen this, I have sat with that person, I have explained to him or her what is in the best interest, what is the intention, and how the work pattern has to be followed.
Right. That
But
again
not
brings us to the distinction between criticism and harassing. More often than not, when a few probably get sensitized to harassment and bullying, then what happens is when they're criticized for work not well done, or maybe, because they've shirked work for some reason, then they often claim to have been harassed or ill-treated. So, I think that also merits a discussion as to the difference between criticism and bullying.
But I will tell you something. Whenever there is criticism, it is a positive criticism. And if you really want, and if your intention is to improve the situations, one should sit with that person, explain the things, give them understanding, make them understand it is in the best interest of all, and help them improve the performance. If I keep on ridiculing that person in public many times, then that criticism doesn't remain positive. It goes into
Right.
negativity and harassment. So as a
Yes.
boss, I must know how should I handle the situations.
Yes.
Can I ask a question to the panelists in this regard?
Yes, sir.
Madam was talking about how she wanted to correct her juniors in the interest of the patient, if I understand right. Okay, if something's going wrong from the junior, she will call and set it right. What about the reverse, madam? Suppose you find that, you know, in spite of everything, that the boss is wrong. And for the benefit of the patient, the junior person is trying to correct it in the best interest of the patients, within inverted commas. How many of us are willing to accept that we are wrong?
Well,
Then
that
my
is
suggestion
sort
will
of
be,
the crux of the issue, right?
then again I think one-to-one discussion makes it a criticism which can go into positivity.
Unfortunately, ma'am, unfortunately, in the scenario that sir has depicted, I don't think many a times, majority, I don't think a one-on-one discussion will help. It often doesn't. And if a one-on-one discussion does help in that scenario, then you know, workplace harassment would not really be an issue. I don't think so.
Can I just add to this?
Yes, Dr. Sangeetha.
I think what has been said is for example, if the junior is right and the boss is wrong, sometimes you
Yes.
can be in a situation where the junior says it in front of the whole team or the whole in front of the patient, which actually undermines what the senior's authority is. But the solution, as Dr. Jayashree pointed out, is to have this discussion at the one-on-one in the room with the consultant. And I wouldn't want it to be generalized that most consultants would not agree to it. Actually, I would like to disagree, because I work with a lot of wonderful consultants, senior consultants, who would actually agree and say, look, yes, there has been a mistake. And how do I know this? Because even though I'm a psychiatrist, when they come and tell me those things, that these things were we went and spoke to our senior and he seemed quite fine with it. So again, it is a context, is how do you communicate to your senior, how are you going to talk about it? Because again, the power imbalance is where it is. So if this junior is going to make a big hoo-ha about it in front of the patient, in front of the team, it then could also be construed as an inappropriate behavior. So so it is a challenging one.
So I again think this brings us back to the personality of the individual. We cannot generalize anything. We can't say that, you know, I probably may have been wrong in generalizing it, but what you have narrated, what Dr. Jayashree and you, Dr. Sangeetha, have narrated, to me, it seems like in a very ideal scenario, it would be wonderful to come across more people who are willing to listen to criticism. But then again, I may be wrong. So it's personal, right? So I think it depends also on the personality of the individual. But that's a very nice angle that has been brought up.
Manjula, if I can add,
yes,
if I can
Dr.
add a
JP.
point to what Dr. Rajesh has just asked. See, by and large, I mean, I've worked with a few, maybe 30 odd surgeons in my short career. And what I feel is, by and large, most of them take it personally. Okay. There are a very rare and few people who look into the best interest of the patient. Immediate responses, they take it personally. And you can't do it right away. Even if that person might, you know, you have to wait for a situation, another situation later, to, you know, when the person is in a good mood, to try and still explain where he or she might accept it. So it's very difficult. And by and large, I'm not even talking about the boss in the rung.
Yes.
Most of them take it personally. When we discuss a patient, most of the time, am I right or are you right? You know, who's right?
Yes.
Who knows better? That kind of discussion usually occurs.
Exactly. Yes.
I
Yes.
just
So
want to say something, Manjula.
Yes, ma'am.
This is about, actually, it is not only the language which matters, or
Right.
whether you are suggesting or asking or intimidating anybody, it matters. What matters is your body language also, your tone also.
Yes.
So if you are keeping the respect of your senior and telling them that, sir, in my opinion, I think should we look at this also, or maybe I have some different opinion here, I would like to understand better from you, then
Right.
typically the tone of the conversation goes in a different direction. But if it starts like this, that, okay, what do you know, I know better, and this can actually spoil each and every situation in our life.
Right. So then again, that brings us to communication. Yes, sir. Dr. Rajesh
Body
Balal.
language works
I have only
much
one.
more beyond the verbal language.
True. I
Yes,
mean,
sir.
there's half the problem is because we're talking about respect for the senior. Means different things to different people, madam. Right? Many of us expect a lot of things, which I'm not sure we must continue. I think those days of respect coming as a given, I think is not fair on our junior colleagues also. Respect must be earned. To say that the way the person speaks is not respectful or respectful, sometimes is not apt.
So I'd like to move on. I would like to talk about this the stereotypical surgical personality. Universally everybody talks that a surgeon is supposed to be so and so. A surgeon is said to have this kind of personality. So does it mean that somebody who doesn't have all those attributes cannot be a surgeon? Can a square peg fit into a round hole? Uh, do as a fraternity, do we surgeons encourage diversity, or would just being different from the lot increase our susceptibility to bullying? Dr. Rajesh Balal, you had an interesting story to share
Yes,
regarding the same.
I did. As we were discussing this, I know this is a problem I faced. I'm not sure anybody else has gone through. And that is, we actually had a student about 3-4 years ago. And this happened in my class. It started class and this person walked in. And instinctively I said, madam, you don't come in. I have a lot of dialogues which I can't share here. But I said, madam, you can't walk into class once I start. And half the class is starting to giggle. They said, so one of the people in the front bench said, sir, it's actually a he and not a she. So you're wondering, and still I'm not convinced that it's not a she. And then we find out after class, I find out that this person is actually going through a sex change operation. And that was absolute disaster for me, because that was the first time I'd come across anything like that. And my mind still refuses to accept that you have people who don't, like Manjula said, who don't fit into this stereotype. I don't think we are ready to accept these people yet. Maybe a very personal opinion, but I think they're finding it very, very difficult, because we didn't know whether to call that person a he or a she. Yes,
Thank you for sharing that story, sir, because that is sort of, even while speaking to you, and I'm sure even to a lot of us in the audience, that has sort of opened our eyes to the diversity, and not to take things at face value. There are people who can be going through so many different things. There are people in different circumstances, and I think it would do well for us as a community to be more accepting, be more understanding, probably. Dr. Jayapriya, do you have something to add to that?
It's easy to say to be more accepting and understanding. Um, we can't preach this. I think as a generation, I think we need more good examples, you and me. the next generation, we are going to be the bosses soon. So we need to set a good example,
Set a
a
good
good
example.
culture, a good work etiquette, I think. Yeah.
Right. So now back to, this the story that I had narrated about the senior and this junior. And now, like I said, this boy who was so effusive and who was so outgoing and, filled with laughter and would make everyone happy. Over the course of time, his smile would just wear thin. He would barely, give a weak grin. He hardly slept. That once handsome boy was now unkempt, would not take a shower. He looked like, he had not shaved in days, no haircuts. And when asked questions in rounds or, by anyone, he would just give a blank stare. He would struggle to string two words together. So that brings me to Dr. Sangeetha. What are the, could you enlighten us? How does harassment or bullying impact people? How can it impact? What are the different ways in which it can impact people?
Okay, for some reason, my answer always starts with it depends. Because there is no straightforward answer. Uh, it very much depends upon the victim. It depends upon who's being bullied, who is the bully, how long it has been going on, where has it been going on, is it public, is it private, what is happening as a result of the bullying. Is the person gone and complained to it, or is the person suffering inside with a lot of self-loathing and anger inside? If the person has gone and complained, what has happened as a result of it? Has there been any punishments? Has it been the person taken to task? What is the peer support like? What is the family support like? So it depends. The whole outcome of what it does to the person is depends on multiple things. But to kind of bring it to an individual level, what really happens is before the bullying actually sets in, you have a lot of these stressful interaction between the two individuals, which are not pleasant interaction. And the person who's at the receiving end of it will always feel some kind of jitteriness, a nervousness when they are going to work. And then you find, and there's still a lot of retaliation. So still there'll be a lot of verbal dialogue between both the sides. And then gradually you find that the bullying pattern sets in, and where the individual who perceives himself or herself as a victim now starts getting really anxious, is not able to concentrate at work, the work performance goes down. And this intense gives the bully more ammunition for saying, look, you're not good at work. The more of the shouting and the kind of the verbal as well as whatever, the intimidation becomes more intense. And you find that now in the fully established bullying phase, the person really undergoes a lot of shame, a lot of anger, a lot of frustration. Why me? Why is it happening to me? What is it about me? And then also anger at the other person. Why is he doing it to me? Anger at the people who are around you and nobody is helping. So you can, and then this further kind of progresses where gradually you find there is an erosion of self identity. I really don't know who I am. You kind of, there's kind of this cocktail of emotions which are going on. And then you find that the work satisfaction goes down. They don't feel like coming to work. The absenteeism sets in.
Yes.
They might also resort to substance misuse, and kind of all kind of dysfunctional coping mechanism. And then the complete withdrawal comes in. And when the withdrawal stage sets in, that's when the person decides, I'm going to leave the job. I'm going to quit. I'm going to quit this course. I'm going to go. Or sometimes they might reach a point where they say, I'm going to do something about it. I'm going to complain. And
Right.
this is kind of at a very individual level. But then often you find, as a generalized thing, if you want me to say, is the victims of bullying often experience a lot of psychiatric issues. So you come across anxiety, you come across depression, suicide, completed suicide attempts in very extreme case, a lot of substance misuse, work absenteeism. And sometimes they also come out with PTSD like symptoms, so post traumatic stress disorder, where they are so traumatized by this whole event. And the interesting bit is, when does it stop? Does it stop once they leave the job? I would say for some individuals, it stops once they come out of the work, they go to a new job, and they find that they've gained their self-respect, they're valued. But for some, even the leaving the job doesn't stop. This kind of emotional turmoil just continues for years and years. You would always come across some colleague, who
Yeah.
would be kind of stuck with one bad incident which has happened, and they've just not been able to come out of it. So this is at individual level, but at an organization level, if there is just a bullying culture is there where this is not addressed, you find there's a lot
Right.
of gossiping, there's rumor mongering, and the morale of the whole entire team, the entire so as you rightly pointed in the first slide, the rot sets in, and the rot then kindly gradually over a period of months and years, and it keeps growing, and where the entire organization is then known for its bullying culture, no matter what other good
It's a
things they're doing.
vicious cycle, isn't it?
Absolutely, yeah.
Dr. Rajesh Palal, sir, uh, how do you think this? Do you think this is just interpersonal, or do you think this, this culture of bullying or harassment can impact an organization or an institution in a big way?
Yes, I think because see today it's not at all very difficult. You see, in the days gone by, if you wanted to get information from me in Mangalore, you needed to know somebody in Mangalore. Today, so many people will write blogs, etc., etc. So many things. I am a little backward in all this, but you put K.S. Hegde, you put Rajesh Palal, etc. You will get the good, the bad, the ugly. So it has to hurt. On the long run, it has to hurt. But the unfortunate thing in a country like ours is we are not actually spoiled for choices. You know how difficult it is to get into an institution. Forget good, bad, or ugly. Right? You try for 2-3 years. You are at the end of your tether. And then you get a surgery seat. You want to do surgery all your life. And then you get in a surgery seat in your third attempt. And you know it's a bad college. Right? And then what happens? Most of us will make do. Because we're not spoiled for choices. All very nice to talk about. I was reading somewhere, people must talk about an exit policy and things like that. There are enough articles on the net wherein it says if you don't like a place, the boss must make sure that honorable exit. But that cannot happen in this country. Right? You can't say, I don't like the surgery department, I'll go somewhere else. There are no opportunities for you at all.
But do you think that trend is changing, sir? Because at one point in time, I do recall that a lot of us were like, we want surgery. We've gotten the seat. We will put up with all this abuse no matter what. Somehow we will get through these 3 years. But off late, I have noticed that they're not, I have noticed, I think, which just shows the strength of character, they're not willing to put up with it. Fine, if this is not working out, I'm willing to leave, maybe reevaluate my prospects.
My point is this: are you willing to give up your surgery seat when you wanted to do surgery all your life? See, because recently in this LGS itself, there are enough and more posts coming up about please help, basically.
Yes.
Right?
Yes.
Please help. So why is that happening? People not willing to give up a seat so easily. It's a bad place. They treat you like dirt. Right? But still, many people are willing to put up just for want of more opportunities. I hope the trend is changing, but I don't see it happening very easily.
Right. Also, who's to say that it might be different in another institution?
Exactly.
You never know.
Exactly.
Never know.
True.
But apart from this taint on the reputation of the institute, I also feel that this whole culture and this trend of harassment brings down the productivity of the institute on a whole. Because then with everyone trying to, in order to downplay the other and, try to get back at the other person, we stop concentrating on what actually matters, patient care. And especially when, you have incidents of harassment that take place in the OT, I think it can have a great bearing on patient care, the surgery that is about to happen. Dr. Jayapriya, do you have something to add to the discussion regarding the effects that?
Yes. I will say it also hampers the academics of that particular unit or the institute.
Yes, ma'am.
Because there is so much of negativity created because of this, that people really forget to concentrate or focus on any particular kind of positivity or constructive kind of mode of action. And I think it is the loss for the person, for the unit, and for the institute, which carries its own legacy ahead. Because that becomes your habit, which you may not be able to change despite of attempts, even in the later phase.
Right. It's a huge dent on the entire medical structure in the big picture. Dr. JP.
Yeah, see, I would just want to add that, see, this kind of, work culture that is toxic. The only thing that I've observed is, see, for example, you take what's happening in the OT. So, there is good understanding between the surgeon, the assistant, everything is, going on in a very nice manner. The outcome is good. The patient benefits. Whereas, we have seen, Manjula, that what outrages that happen inside the operation theater between the operating surgeon, the assistant, the harassment and bullying, and it negatively impacts the patient outcome.
Yes.
And you see, workplace harassment happens in all fields, but in our field, when we consider the operation table and the patient to be God, we pray and we start. It is like meditation. It's so divine. And in a situation like that, you have to encounter colleagues who are, who create a hostile environment. It doesn't do any good to the patient.
It doesn't. And I must add to that. So I still recall when I anticipate hostility. When I anticipate hostility from someone, and I'm in the OT, and I know that it's going to happen, I can tell you, I visibly experience tachycardia. I start getting anxious. I start getting jittery, and I'm not able to concentrate on the surgery. I'm not able to I'm just wondering, what's he going to say? What's she going to say? How do I retaliate? The whole focus shifts away from patient care, and that is not healthy, right? It just impacts, it just has a negative impact on the whole thing. So I'm going to move to the next section of workplace harassment. So we're going to talk about sexual harassment. Before that, does anyone else have anything to add to how this may impact the organization or the individual or the group? Sir, madams, Dr. Jayashree Todkar, ma'am, anybody? Right. So I'm going to move to sexual harassment, right? And none of us are strangers to this term. It has been oft discussed. We've had the Me Too phenomenon, which has sort of, which was which sort of was widespread all across the globe, all professions. But surprisingly, it did not take up in the medical community. And why is that? Is sexual harassment not a very common phenomenon here? Is it that we don't see a lot of it? Before we move on with the discussion, so we're going to do this exercise. I wish I could actually involve the audience for it, but I really couldn't come up with a way to do the same. So I'm going to give you 5 questions, and I would like the panelists to vote yes or no. And if you have a neutral opinion, just tell us it's neutral. I would like to request Dr. JP to please sort of note it down, and then maybe we can discuss it further, right?
Manjula, if there is a poll available here,
yes,
suppose you have a question, yes and no can be an option where everybody can participate. But then that I have to type out the, if we have an easier method, that's fine. There's a poll available.
So how about I read the question? Can they press yes or no?
Okay, question 1. Now we can have a poll.
Right. So question 1, everyone. So Miss A, okay, she is a postgraduate student. She is scrubbed as, hello, am I audible?
Yeah, you are.
Yes. So Miss A is a postgraduate student. She is scrubbed as a second assistant in a major case in the operation theater, along with her senior consultant, the first assistant, and the anesthetist. And all 3 of them are gentlemen. So now the male colleagues, they pass an X-rated joke. She is not included. They pass an X-rated joke, and they all burst into raucous laughter and then throw sly glances at her, at the lady postgraduate. Is this sexual harassment? Yes, no, neutral.
Yes.
10 seconds, right? Those who say yes, can you please raise your hands amongst the panelists? Is this sexual harassment? Dr. Jayashree Todkar, I'm not able to see you on the screen. So did you raise your hand for this? No, or is it neutral? JP, can you just like sort of document that? I'll move on to the next question.
I don't think
Right?
this is sexual
So
harassment.
yes, ma'am. Okay. So question number 2.
Manjula, you can allow any outsider to ask a question to somebody is raising a hand here at this juncture? No.
So can we have it at the discussion bit?
Okay,
Because,
okay.
thank you. So question number 2, Dr. A gentleman, he sends a WhatsApp meme, okay? He forwards a WhatsApp meme with implicit sexual content to a lady colleague, a peer in the same department. Does this count as sexual harassment? JP, for the first question, I've raised my hand, sorry.
Manjula, you're not telling us is whether this female colleague, the second question, whether
No.
she felt offended or not.
No, no, I'm just telling you that this gentleman has sent his peer, a female colleague, a WhatsApp meme, which has implicit sexual content. Is this sexual harassment or not? My hand is down for this. Down.
I say
right.
it is sexual harassment.
Okay. JP, please document that. Question number 3. Okay. The scenario, it's a coffee shop. You've just finished rounds. You know, so coffee shop in the corporate hospital, and you have these 3 or 4 doctors who are standing and they're discussing over a cup of coffee the sex life of another colleague, and she is not present at the moment, right? They're having a lot of fun discussing all the vicious details of the whole relationship. Now, is this sexual harassment? My hand is raised up. Okay.
No.
Okay. Dr. Jayashree has said no. JP, please just note down that, yeah? Question number 4. A senior member of faculty, okay, is in a medical college. He's supervising a lady intern who's dressing a scrotal wound, okay? So as she's handling the scrotum, in order to go ahead with the dressing, you know, this fellow, he comments, why are you, you know, handling it like that? Handle it with love and care. And then he grins. Is this sexual harassment?
Yes.
I won't call it.
Okay. And now the last question. Okay. So a female postgraduate student, she walks into the ward at 7:30 in the evening for her evening rounds. There is this, her second year PG sitting at the nursing counter who looks at her and then just says that, oh my God, you are smelling wonderful tonight. Very seductive. Is this sexual harassment?
I will say depends upon the tone.
Right. Okay. Okay.
Why is Dr.
So,
Sangeetha quiet? She's neither raising nor putting a thumbs down or saying neutral.
Ma'am, Dr. Sangeetha, if you have a neutral opinion, you can say neutral. I have left it to JP to sort of document all that.
She is the expert, so she is analyzing us.
Probably I'm thinking here because the last one where somebody's made a comment that you smell nice and you smell seductive or whatever. I really couldn't. You know, it very much depends on the opposite person. Again, my standard
So
answer is
can
it
we,
depends on what the
Manjula,
person.
sorry to interrupt, but can we say that you're neutral?
Manjula, just for a minute, anybody,
Yes, sir.
well, I always compliment them on their face. But you call it sexual harassment, I do not know.
So we will come to that in the discussion. So, Dr. Sangeetha, shall we just take yours as neutral?
I think you should take all the comments as neutral. I think for one I said yes, where the sex life of a female colleague was discussed when she was not there. So she was not there to defend herself. But for other
Yes.
things, I would put it as neutral.
Yes. All right. So before we come.
Which question was that? That sex life question. Question
The
three?
sex life was question 3.
Okay.
Question 3 was the sex life. Right. So now just a quick look at the statistics. Okay. So sexual harassment is a very big issue universally, and India is actually quite high up on the rung, equally by both men and women. All right. So there was a study in the US by Kaloff et al. Where 40% of the women and 29% of the men out of 500 undergraduates, they had been sexually harassed by a college professor or instructor within or outside the campus. And on some data on India, so there's this exploratory study from Kolkata 2005-2006, wherein out of 135 healthcare workers, 2 private and 2 government colleges, 77 of these women health workers had experienced sexual harassment of different kinds. All right, different types, verbal, physical, etc. We will come to that in a bit. And majority of these women, of these 77, majority of these women had not complained, right? So what do you understand by sexual harassment, Dr. JP? What is it just the obvious, the physical element? What do you understand by sexual harassment?
See, we all know the obvious. Okay, somebody is trying to, okay, harassment, you know what, I forgot the word, but this for that. Okay, so if you do me a sexual favor, I'm going to do a favor in terms of a promotion or an employment or passing your PG or whatever. So they're all explicit. Or somebody is making physical advances at you, or things like that. So they're all very obvious. And this we all know, but there's a whole range of subtle things that I've noticed, and which is not talked about. And the most important thing again here is a lot of men who are involved in these subtle phenomena are not even aware that this can amount to harassment. So if you ask me, again, I'm saying this to sensitize the men who are watching this, and the women as well. Many times they don't even know this might be sexual harassment. So yeah, and so in all these examples where half 50-50 or majority, they don't agree, disagree, we don't know if it's harassment or not. So if you look at the Sexual Harassment Act of India 2013, one important thing I read in that is, it is not the what is important when somebody is complaining of a sexual harassment. What is important is not the intent of the person who passed a remark or a comment. It is the impact it has on the victim. So by and large, what is considered it is a casual joke. Why are you being sensitive? So my intention was not even to touch your little finger. Okay, my intention is just a joke, and take it easy. Why are you being sensitive? So your intention might be right. The majority of times is what happens, and this is what happens in day-to-day work atmosphere. But it might have a lot of impact on the person who's on whom this is addressed to. So, and many times, I mean, most of the times, these are people who are lower in the hierarchy, who are subordinates, women who are lesser and who can't retaliate, or who might not be able to stand up for themselves and say, this is unacceptable. What you're saying is wrong. So, and then they cringe in private, they cry in private. There are instances that I know, I mean, majority of the times, the instances that come to my mind of nurses who have spoken to me in workplace and say, this doctor said so and so, I don't know what to do. And I feel so ashamed. I feel so helpless. I want to leave this job. It could have been just a passing remark, or something about the way they look or their body parts, or some subtle implicit sexual joke that was made and considered normal. So that is what I feel about this, and I want us to discuss these answers to the questions that you've asked.
Yeah, so we will come to that. Just before that, I just want to, there's this definition, the Supreme Court judgment that you're all seeing on the screen that I've put up, right? So it includes physical contact, advances, requests for sexual favors, displaying pornography, other advances, physical, verbal, non-verbal, etc., which sort of all put together comprises sexual harassment. What I would like to talk about here is actually how a lot of us are not sensitized to what actually constitutes sexual harassment, and to which I would actually share something that happened today. So while I was in the OPD, there was one of the auxiliary staff just passed by and said, hello, Dr. Manjula, how are you? And I said, oh, hi, how are you? And this was a gentleman, and I just looked at him and said, wow, you're dressed so smartly today. What's the occasion? And because of all this research that I was doing, all of a sudden I was like, was that inappropriate? So having said this, I would actually like to now discuss the answers to the questions that we have asked. Dr. Patta, sir, can you also share your vote with us, please, as JP reads them
Can I
out?
interject?
Yes, sir.
Yeah, I have to tell you two episodes, two instances of the reverse.
Yes, sir.
As an undergraduate student, MBBS, I obviously can't tell you the subject. We had a lady examiner who came, right? In
Yes,
one subject, all my girl classmates were made to wear a sari definitely for the exam. You had to wear a sari. There was no other go. Is that harassment? The expert, is that harassment?
It depends. I won't call it a sexual harassment in the form of the definition which fits here, but if you were uncomfortable doing it, and you were not, kind of, it made you were in a position where you couldn't actually say no, I would say yes, it was harassment.
True. And as a student, I have no say in this matter at all. If my examiner wants me to wear a sari, I will. And I know how uncomfortable my girl classmates were. And the reverse of that happened was when a lady examiner came for another subject. And I had a classmate, a gentleman, a male student who had a very luxurious mustache. And the entire viva was only on his mustache. And he passed out with flying colors. So that's the reverse. Right?
Yeah. And I'm sure a lot of us have such stories about having similar experiences in Vivas.
I think
yes, ma'am.
I
Dr.
think
Jayashree.
it is very, very important for us to know whether our comments or whether they are in the light mode or serious mode, and the body language makes the person in front of us uncomfortable or not.
Exactly.
If you are making that person uncomfortable, you are harassing that person.
Yes.
And if it is going in a very lighter mode, both the people are just not bothering about that serious uncomfortability or leading to that any kind of discomfort, then it can be very, very casual.
So
At
we
times,
all,
as a woman, many of us will agree for that woman has got a very specific sense of something going abnormal. So even if somebody is looking at you or somebody is putting his hand on your shoulders, you understand whether it is just a comfort friendly hand or is it something which is palpating your brow.
so I would actually like to say that, it's very evident from what everyone is saying that it really is very subjective. It depends on the person involved and also the relationship between the parties involved, how comfortable or how well versed they are with each other to actually come to consensus of sorts. So can we, JP, can we go and discuss the answers to the questions? And Patta, sir, may I also request you to sort of...
Actually, I didn't do the polls because JP made the whole thing very easy. But before you go into, I'll just make a comment because maybe I
Yes,
have
sir.
that right to do that. See, the thing, we work in circumstances or institutions where, most of people walking are very stone faced, there's no smile, nothing. And
Yes.
actually, if I have to meet you, for instance, for the first time and I have to say something, I can't say the weather is good. I can't say, have you had your lunch? I can't say, have you slept well last night? I said, you're dressed well. I mean, will that amount to sexual harassment? I do not know. Because, I'll only talk because if I know Manjula. If I don't know Manjula, I can't come across somebody whom I do not know and say something. This actually, when you talk to a lady colleague, the first thing you talk about how they look or how they dress, some nice things, not about the weather, not about yesterday's dinner or whatever.
So, sir,
Or
can
some case.
I actually have a reply to that, sir. So let me tell you, if suppose somebody I don't know, okay, comes up to me and tells me, wow, you're looking great. you know, the first thing that's going to strike me, so I'm just going to go like, oh, honestly, if I'm very honest, I'll feel very happy that, oh, you know, I'm look, you know, he thinks I'm attractive, but that's the only thing that's going to register, that, oh, he thinks that I'm attractive, because I don't know that person, and the only thing he's commented about is, you look great. So the first thing that's going to sit in my head is, you know, he finds you attractive, which is, but on the other hand, if someone just comes and says, hello, how are you? Are you good? Are you doing well? It's a different thing. On the other hand, if somebody I know very well, you know, my buddy, he comes up to me and says, oh, wow, Manjula, you're looking really good. I'll go like, oh, wow, thank you. But and this is very personal, so this is the way I am. So probably I'll just go like, oh, okay, great. I'm looking good today. And, you know, I'll sort of feel happy that fine, you know, I've gotten, what do you say? Like, you know, somebody's told me that, yeah, you're looking good, but I won't take it the wrong way. But if somebody I don't know comes and tells me, I would call it harassment because I'm not harassed, but yes, I would see it in different light.
Certainly, I agree with that. Somebody who we do not know cannot say that. Yeah, we can go to the questions.
JP, the first question.
Why?
So the first question was the one
Sorry,
in the
sorry.
Yes,
Sangeetha wants to say
Dr.
something.
Sangeetha.
No, I just wanted to ask Dr. Patta as why not? You know, see, I think we in kind of labeling everything as a harassment and giving it a prefix of sexual harassment, we might actually end up making the workplace quite boring. We have to be really careful, you know. Men and women, we work together, and sometimes as a psychiatrist, I know that a lot of interaction between a man and woman has kind of a flirtatious connotations, and kind of can have kind of a different flavor to it. But what is important, even in the definition that you're writing there, it should be unwelcome. You know, somebody coming and saying, oh, you look pretty, even if that person happens to be a stranger, would not be definitely construed as harassment. So we have to be careful what we label as sexual harassment and what we don't, because when we label everything under a sexual harassment, we are actually diluting something which is very, very important and very, very serious incident.
That's exactly what I was saying as well. I don't think it's sexual harassment. I would never go, you know, I would never complain that, oh, you know, that fellow's, you know, I underwent sexual harassment just because he told me I was looking good.
No,
But it's probably not the first
the
thing that I
point,
would.
Manjula, here,
Yes, sir.
men have very few color choices to wear. If you see their pants, there are only 3 colors. If they, you know, there's nothing to say good about a man, actually, frankly, and they don't spend any time in front of the mirror. See, the whole world is beautiful because of the women folk. Okay, and you know the whatever color joy happen in the canteen, if we are standing, and you know, 3 girls walk in and they're all so very colorful. We take notice of that. And I think girls also notice that, they notice all that. See, there's nothing wrong. If you follow up with something more, it's a bad thing. But I think these things, you know, they appreciate and without a wrong connotation. I think girls don't say anything to men folk. There's nothing much to say, actually.
Yeah, so actually before we go ahead,
can I say something about that now?
Yeah, JP.
JP, you know me very well, so be careful.
See, there is a very thin line between, you know, saying that you're dressed well and saying something about their physical appearance. Why should a man always comment about a lady's physical appearance? There's so many things to brighten up the day. Why should it be about the color of the dress or how they look? There's so many things to discuss. So what would you say to cheer up your male colleague? So, no, what would you say to cheer up your male colleague?
May I add to it, Dr. Patta?
Yes.
Yeah, Anjali,
yes, ma'am.
Yes, sir. I totally agree with Dr. Patta because see, the thing is, when you are meeting for the first time to any female, it's always a gesture to say that you have dressed well and to appreciate the beauty and to appreciate the well dressed female. That is, I think, the to impress or something like that is the first interaction sentence actually to begin with. and that should not be obligatory sentence in any situation. Being in the scenario where male and female are working together, and I do not think at all, I totally agree with Dr. Patta that you cannot comment on yesterday's dinner, how it was, you cannot comment on the weather, you cannot comment on the how was the day of the conference. So exactly this would be the first sentence, and it should not be of sexual harassment at all.
So, Dr. Anjali, before we move on, I actually want to, today when I was driving back from work, I stopped someplace to grab some lunch, and I saw this girl. She was dressed amazingly and fantastic shoes. And she was a stranger. I have no idea who she is. And I actually stopped and said, wow, you look fantastic. You're looking very good.
Sexual harassment.
I am talking about, Manjula, I am talking
Yes, ma'am.
about on the platform where the victim and the person are on the same platform. I am not asking like on the stranger or on the street, you are asking how well dressed you are. It is inside the forum, it is inside the platform where both of them are of the part of the same function. That is what is the scenario is. Do you agree, Dr. Patta, sir?
So, ma'am, the thing is, I don't think there is a right and a wrong here. So, I think I don't think anyone's right or wrong. I think we're discussing perceptions here. So, what I was trying to say is that even if the stranger,
but Manjula, this is, I think on this, this is not expected from the person like Manjula. This can be accepted.
I'm sorry. I'm sorry. No, I'm sorry. I want to know what do you not expect from me?
No, can I ask?
No, sorry, Manjula. I mean.
Okay.
I'm sorry. What do you not expect
Manjula
from me?
will cross over. Let Rajesh speak.
Yes,
I'm only asking, let's lighten the mood a little bit. It's okay. Because I've never heard of anybody say the guy looks handsome in his stud shoes, right? He's wearing, whatever, these sort of studs and the jeans, etc. That hardly ever happens. So, even between colleagues, you never greet a person saying that, oh, wow, your aftershave smells fantastic today. I've never heard people say that, have they?
And yet I was greeted like that. I was actually greeted like that. So that's the reason I put up that story.
I suppose it depends on the institution, sir, because some of the institutions that we work, we don't hesitate in telling our male colleagues that your shirt looks fantastic. So I suppose it varies from place to place.
I've never been so fortunate. Never been.
What?
Sangeetha, that's very unfair to call the shirt is good. We never say sari is good. We never say, the blouse is good. No, that's not fair.
Can I see, there is a comment from one of the audience saying, Ms. Surabhi Krishnamurthy saying, when it comes to greeting a female colleague, we can always greet them saying, hi, how have you been? There is no need to bring in physical appearances, is what she's saying. And to add to that, again, what constitutes sexual harassment is not what you said, how it made that person feel. So it's not just the word of you look good in this sari, it is the tone, your body language, and the situation. And many times, if you could compare saying that to a junior colleague as vis-a-vis to a senior colleague, a female colleague, many times you wouldn't say it. Just for the fear that this person is a senior and she won't take any nonsense with. So there are enough number of ways to greet a lady other than what she is wearing or how she looks, is what I think.
Manjula,
and if you want
15
to
more minutes, so you need to,
Yeah, so actually, I'm just going to sort of round this whole thing up. Before we move on to the most important thing, the solutions, we haven't had a chance to discuss the results, but what I want to put out there is that, it's very ambiguous. It's not in black and white that this is wrong, this is right, this is sexual harassment. It is very ambiguous. It depends on the relationship between the two people. It depends on how you've made the other person feel. Even if you're friends, even if you know each other. So you can't say that, oh, that is right, oh, this is wrong, this is sexual harassment. No, it's a very ambiguous entity. But at the end of the day, if you've made the other person feel uncomfortable, he or she, not just, let's not restrict it to women, even the men, even if you've made them feel uncomfortable, then they have the right to call it sexual harassment. And if it's brought to our attention, I guess we just need to take a step forward and try and change that, or see, you know, what may have gone wrong. Before we move on to solutions, is everyone, like, you know, does anyone have anything else to add to this?
Are you opening it to the audience?
No, the panelists, sir, the panelists.
Panelists, okay.
We just another 5 minutes.
You need
Another
to give
5 minutes.
audiences some time at the end.
Yes, another 5 minutes for the solutions, and then we can open to the audience.
So I would just like
one
to.
thing.
Yeah.
Please go ahead.
Yeah, so
Dr. JP.
See, I would like to add one thing to male colleagues. See, when you're talking to a female, why not ensure utter professionalism in the workplace? Because you know who is close to you, which female colleague is close to you. You can comment about her color of her lipstick or her dress, but why not, you know, commit to utter professionalism in the workplace? What's wrong with that?
Right. Let's talk solutions. Okay. How do we, you know, go about combating the whole thing? Dr. Rajesh Ballal, do you have any insights, sir?
Ideal situation, first we accept that there is a problem. Then we make sure that it gets reported well. This is ideal. Gets reported, but it must get reported in such a way that if I am the victim, I don't have any repercussions. I must be free to speak my mind, and within a reasonable amount of time, some action has to be taken. If I know for sure that some action is taken, provided that the perpetrator is wrong, then it will encourage other people also to follow the same path. But I'll tell you what happens. What happens in practice is that I am absolutely powerless. I have no way to complain against the system. And I find that most instances, colleagues and people who have complained are often, you know, sort of ostracized. In that it said that, look here, you don't know how to adjust. Right? And that's where I think most of the problem is. Basically, I think we must accept and we must try and change. This is the ideal situation.
Dr. Jayashree? Ma'am?
Yeah. First and foremost.
And I would like to specify that we're talking about harassment on the whole here, not just sexual harassment, ma'am.
Correct. First and foremost thing is, we should express our displeasure and discomfort in taking up that from the second or third instance itself. First or second time, you may say that, okay, give some benefit of doubt to that person. So maybe they are not aware of what they're doing, or they are hurting us non-intentionally. But if it is coming into a repetitive mode, then typically your first job is to express the displeasure very, very frankly. Number two is not only to the other parts of the unit or other people, but to that personality himself or herself also. Second part is, please talk about it and don't sulk. Talk about it to your colleagues, to your maybe the next level of seniors, so that everybody knows what you are going through, and they can really take care in terms of protection of the whole goodness in that unit. The third part will be, if still it is not happening good, then take it to the boss of that person who is bullying you, so that again that person, with the hope that would take the cognizance and talk to the person and set it right. The fourth part will be, if this is not going through the nicer way still, and it is happening in going worsening mode, then typically you have to make a big noise about it. Because otherwise, one fine day, people will do, the bullying person can do mob lynching kind of thing about you. They can do the mobbing, they can do a lot of lynching, they can do the smear campaign, And the bigger the boss who is bullying, the more people will go under his umbrella and be a part of the noise against you. So smear campaign can be worst thing that can happen about you. So please start putting your displeasure in a very, very subtle but positive, expressive manner from the beginning. This is
Yes,
most
ma'am.
important. Yeah.
Ma'am, so ma'am, do you have a point three before I interrupt you? Do you have like another something to add to that, ma'am?
No, you can tell, you can talk.
So, ma'am, I actually agree with everything that you have said, and I believe that we must speak up when made to feel uncomfortable. However, it is not easy to do so. No matter how confident the person, speaking up is not always easy. Dr. Sangeetha, I would like to ask you, do you have any suggestions as to how one can maybe muster the courage to speak up, or maybe ways in which we can do so?
Um, See, it can be one is where we look at the one-to-one interaction. So when somebody comes to me who's been a victim of bullying, the job of the therapist or the psychiatrist is to empower the person to come up with their own solutions, because we really don't know what the situation is for the patient, for the person. If he goes and complains, it is possible they might lose the job, they have a big loan. There are so many things that one has to think about. So it's never easy to say go and do this or go and speak to this person. That has to come from within. And often where the therapist or a counselor or whatever you want to call them, we help them to come to terms with what has happened, kind of help them to build up the self-confidence, self-esteem, help them to also get support from the family, from the peers, so that this kind of sometimes, going and complain, just making a single complaint becomes difficult. But on the other hand, if this is happening as a collective thing, where many people are a victim. Now, if you see, the best example is a Me Too. Me Too started off with one, and it's picked up so much of fire is because it became a collective thing. So sometimes seeing, are there other people who are affected as well, maybe going and complaining together. But more importantly, which I think both the senior consultants were talking about, is to have certain formal and informal processes. When we talk about formal processes, every institution should have a committee which is designated person whose job is to kind of address these issues. And it should not be just one person. I think it should be a couple of or a few people there, which should be seen to be unbiased. It should not be this committee should in no way have a direct connection with the person who's bullying, and this committee should have teeth in it. It should not be just because it has been recommended, so there is somebody sitting. They should be seen as people who can bring about change, and it should be a step up approach. So every department should have it, every institution should have it. It should happen at the management level. And the good thing which came out of the whole Nirbhaya case was the Vishaka committee, where now it is mandatory for every institution to have a sexual harassment committee, where our institution itself has it. So we are not a very big institution, but we have it, where people from outside, so NGOs, independent people from outside sit in, and it is chaired to look at really the serious issues. We're not talking about the minor comments, but serious issues. But when we talk about the informal processes, see, people often kind of think that it's only the formal thing which is important. Informal things are also extremely powerful. So role modeling. So what is happening? So who is the head of the department role modeling? Is the management role modeling? So if you're an institution saying we are not going to tolerate bullying, but you find that the head of the department does bully, he does shout, then what is the point? It's just a paper exercise. So there has to be a lot of role modeling. There has to be a lot of training, education, awareness, bystander training, bystander awareness. And these kind of forums are the stepping stone for setting these things in place. Now, if you look at around 10 years back, none of the colleges or schools had counselors, and so much of noise was created that now most of the institutions have one. So such kind of training and awareness needs to happen right from the medical school days, so that when the person grows up in the career, they know what is right and what is wrong, who to complain, there are processes, and what their rights are. And the last thing when JP was talking about is a lot of gender sensitization. That also needs to happen as more and more females are, working shoulder to shoulder with men. These things needs to also happen.
So at this juncture, I would actually like to sort of let the audience know. I encourage you to all go online, maybe after this, whenever you have the time, and read this document that's called a Sexual Harassment in the Workplace Act 2013. It's only while researching for this panel that I realized that for every healthcare or any organization with more than 10 employees, they have to have an internal complaints committee and a sexual harassment committee, which is supposed to be balanced, unbiased, with a few members from the outside, and there must be a good balance of men, women. And that document actually gives you a lot of information on how you can sort of tackle this issue and redress it. I would have discussed it here, but we don't have the time to do so. Dr. JP, do you have suggestions as to the solutions to this, combat this, something to add to the
See,
whole thing?
one solution is on a personal level. See, I had situations in my life when I was harassed. And once I was talking to a gentleman and said, this is a problem. What should I do? A senior person. Then this person told me, you should become stronger. So how does one become stronger? It's easy to say, okay, you should be bold and retaliate and things like that. So this is what I've discovered, and this is what literature says also, that somebody is doing something that's making you uncomfortable. So step A is tell them that you're doing this, number one. Step B is what effect it has on you. I'm feeling hurt. I'm feeling uncomfortable. This is not right. And step 3 is stop doing what you're doing. So these 3 things can be said in a very neutral tone, but in a very assertive manner. So for example, I take an example of sexual harassment where somebody is leaning onto you in the OT. You're a lady, somebody is going on leaning onto you. Okay, you're feeling uncomfortable. Many times women just keep quiet and try and wriggle out. And so what you can do is, Mr. So-and-so, Dr. So-and-so, you're leaning on me. Number 2, I'm feeling uncomfortable. Number 3, please move away. So these things can be said in a neutral tone and in a very assertive manner. So when you say this, this is again for the women. When you say this, it is important that you look them in the eye, broaden your shoulders, and your spine erect. So they understand that even my body language, you shouldn't be meek and very, submissive. So it is important to tell them in a very assertive tone. So you can't do it on day 1. Like what Dr. Jayashree says, it happens day 1, day 2, day 3, maybe day 10, and then you pick up courage to talk. So you should have an example. So a female colleague or an example who has done it, or you've seen it. So it is important for women to empower each other. So you've seen a female colleague do this, then you get the courage, you become gutsy to do it. So first time it's very difficult, but then practice makes perfect. You can practice it in your head, you can practice it in front of the mirror, and you can do that. Number 1. Number 2, when you're actually doing that, it is important to not judge the person who's doing that to you. So many times it could be a male colleague who are completely unaware of what he's doing to you. He's doing that to you. So it is important to not be judgmental and not become emotional. So you can't say, how nasty you are, you're doing this to me. It need not be anger, it need not be emotion. So one has to learn to talk in a very neutral manner and not judge the person, but the action, and say it in a very assertive manner with a very neutral tone, in a very polite manner. So somebody who has done it unintentionally is going to say, I'm sorry, this happened, I didn't mean to. Somebody who did it intentionally but who now knows, oh, this person is responding in this manner, will again say sorry, and he'll know, okay, I should not mess with this lady. Third, somebody who did it with the intention, who is now caught off guard, he'll go on a defensive, no, I didn't do it. Why are you becoming sensitive? I didn't do it. Things like that. So again, then it goes into a fight mode. That's when nasty things happen. Again, you expect this to happen, and you say, you did this to me. It makes me feel uncomfortable. And the same tone, keep repeating it. So that diffuses, and when you say it loud enough, not shout loud enough for your other colleagues to hear, then it fixes this person. So of course, it goes beyond that. You go and complain and you get help. So this is very important for every woman. If you've harassed day 1, day 2, day 3, you learn to speak up for yourself. It's not easy at all. But somewhere along the line, you have to speak up for yourself.
I'd actually like to add one more point to this whole thing. I always feel the foundation has to be strong. So for any issue, and also this, I believe that, maybe it would be beneficial to have things like communication, etiquette, our rights the acts that are, provisioned for us, laws applicable to us. I wish that we would have all learned this or been taught this, during our undergraduation itself. Because even now, as a professional, if I may, uh, let you in on a personal secret, I still struggle. I still wonder, oh, am I being professional? Is this right? Or is this my right? Many a times I feel, maybe I'm not entitled to do this. So I think maybe, we could benefit from having these things taught to us in undergraduation itself. So before we wrap it up and throw this forum open to the audience,
we got 2 more minutes, Manjula, because we need to go to the next program.
we can
Nivedita, you want to say something?
Audience,
Nivedita, you can unmute and comment. Or anybody else for that matter.
Sir, may I comment?
Yeah.
Just to say, I did not mean to hurt Manjula or something like that. Don't take it personal, Manjula. I just wanted to say that when we are working with a shoulder to shoulder with the men, that was my intention. Nothing. Don't take it personally, please. If you
so I have not taken it personally, ma'am. But I'll tell you what the issue was. I believe that we are all different individuals, and we all have different perceptions. And like I said, there is no right or wrong. I may be right, I may be wrong. You may be right, you may be wrong. But we have to be accepting of everyone's perceptions. I did take offense to the fact when you said I did not expect this from you, because
that doesn't mean you.
I know, ma'am, but let me complete my sentence. I'll tell you why. Since this is an open forum, A, with all due respect, ma'am, you don't know me, and B, what I was trying to say, that I wasn't saying this is right or this is wrong. I was just saying this is my perception. And I didn't say that, oh, that's sexual harassment. No, I don't take it as sexual harassment at all. At least the incident that's portrayed. But yes, there are people who can take it as sexual harassment. So what I'm trying to say, that it's very ambiguous here. Right. So before I eat up everything, I'd like others to also.
Two last comments. You can have conversation outside of this forum. Surabhi, what is it? Yeah, Nivedita.
Yes, sir. Half a minute, sir. Just. I think it's a very nice discussion it was. Just to say that I think it's just an individual decision also to decide whether to assess and decide whether what the other colleague wants and why the comment has come. So I feel it's quite an individual perception, and you should be strong enough to be against it if you don't like it, and you have a body language to decide, and I think you will have the correct reception for that. Thank you.
Thank you.
I have to say one thing, Manjula, if you allow me. Okay. We as women, whether we are surgeons or not, we really face a lot of things like this in the society. Not only from the colleagues, but many other people also. So what my suggestion or what my understanding for this situation is, we should be aware of we should be alert for our dignity and respect for sure. But at the same time, not to go behind everybody who talks nonsense. We have to choose our battles right. We don't want to waste our energy into something which doesn't go anywhere.
Right.
Yeah, Dr. Surabhi, last comment before we close. Dr. Surabhi Krishnamurthy.
Yes, sir. I just wanted to ask a question.
We can't see you. We can't see you. Can you put your camera on? Yes.
Yes, I just wanted to ask a question. It so happened that during my post-graduation, I lost a colleague of mine who committed suicide due to, there were rumors that she committed suicide due to workplace harassment. But it so happened that after this incident happened, almost every professor in the college kept talking around in hushed tones around female postgraduates and kept commenting saying, oh, we should be careful around girls. They shouldn't end up doing the same thing. Would this amount to harassment, and what should we do in such a situation?
I don't think we have time to discuss that, Surabhi. We are just looking for a comment because this will require a very lengthy answer. And Manjula, if you permit me, can I close the session?
Yes, sir. Thank you, sir, and thank you to all the panelists.
It's wonderful. And next, as Dr. Sangeetha says, we need to have more of this. It's a matter of awareness to, to sensitize individuals that these things are abnormal, and it should be, one should be aware of and correct themselves. Thanks everyone for their time.
Thank you so much.
I'm so
Thank you,
sorry
everybody.
this
Thank
could have
you.
gone for a little
Thank you.
longer time.
Thanks
but
so much.
Dr. Rajesh, thank you so much. And
Thank you,
then
sir.
I need to get to the next program. Thank you so much. Thanks
Thank you.
everyone.
Bye.
Thanks
Bye.
Manjula for all that.
Thank you.
Thank you, sir.